I'm going to give an overview of the history of family therapy, which I think is relevant because family therapy really began outside of the mainstream of mental health. Many of the key players in the development of the field actually were not mental health professionals. There were anthropologists, sociologists, even a few engineers. And I think the other thing is that family therapy developed outside of traditional academic centers like universities. And with a beginning somewhere in the 30s, perhaps, um, family therapy was always seen as sort of a rebellion against individual mental health conceptualizations and individual therapy. And so it really was not accepted by, quote, respectable psychologists and psychiatrists until relatively recently. It really began with family theories of schizophrenia, and I'll come back to this, but at this time historically, the view of schizophrenia was that it was not a genetic condition, but it was caused by odd and dysfunctional patterns of family communication. Well, as it continued to develop, distinct schools or approaches to family therapy evolved. And by the end of the 1970s, these were fairly well set. And you have textbooks like the one for this course, and the way I teach the course, talking about structural family therapy, strategic family therapy, behavioral family therapy. Each of these has its own description, an account for why families and couples have problems, and also specify techniques that the therapist should use. Well, sometime in the 1990s, people began doing research on family therapy, outcome research, and lo and behold, it was generally seen as effective for mental health problems as prevailing individual therapies. And when I talk about individual therapies, I'm talking about psychodynamic, psychoanalytic, humanistic, cognitive behavioral, etc. So in the 1940s, during the Second World War, many kids, particularly children in the area of London, were sent by their parents to rural areas in England because London was being bombed very, very heavily. And John Bowlby, who you may remember from attachment theory, was one of the first to study the impact of this on children. And at a psychoanalytically oriented clinic that's pretty well known called the Tavistock Clinic in England, Bowlby began working with infants and their caretakers. And when children were somewhat older, he would see them in what at the time was traditional individual child therapy. He saw family members separately, so you would do therapy with a child, typically play kind of therapy, and then you would have a separate session with the mother, father, or both. But they weren't being seen all together. So a guy named John Bell was a sociologist, and he spent some time with Bowlby and then came back to the United States and started seeing families together at the same time in the same room. When Bowlby heard about this, he was aghast because that's not what he was doing. This is also in the 50s, a period in which families were blamed for mental illness. One of the early accounts is the schizophrenic mother described by Frieda Fromm-Reichmann, who was hostile yet at the same time very controlling of their child. Now, marital therapy is interesting because it really evolved separately from family therapy, and as family therapy developed, it sort of came into the family therapy fold, and we talk about marriage and family therapy. In fact, a major professional organization in the area is called the American Association of Marital and Family Therapists. But there wasn't really any theory guiding marriage counseling. People who were providing it oftentimes were social workers and community agencies. Another well-known dyad that contributed to work with couples, and their work kind of peaked in the 70s, were Masters and Johnson, who were pioneered sex therapy and described sexual dysfunction. By the 1990s, John Gottman, who was a psychologist, was doing research on couples' communication patterns and was actually looking at husbands and wives' physiological responses when they were interacting with one another. And from this, he and his collaborator, who was also his spouse, Julie Gottman, developed an approach to marital therapy. And so eventually, marital therapy sort of merged with family therapy. But again, as I said at the outset, it's really important to appreciate that family therapy was outside of the mainstream. It was not what respectable psychologists and psychiatrists practiced. So in the 1950s, there were several places where family therapy sort of grew up independently. Bell, we've already talked about. Murray Bowen, we'll talk about a lot. Murray Bowen was very innovative. Again, this was a time that we believed that patterns of family interaction caused schizophrenia rather than genes. And Bowen actually got a grant from the National Institute of Mental Health to study families in which one member had schizophrenia, and they built these cottages on the grounds of the Menninger Clinic for the families to live in as part of the study. Nathan Ackerman was a psychiatrist who actually was strongly influenced by the Great Depression and saw how families were very disrupted and in a way that impacted their children at this time when, in our country at least, there was great economic strain placed on them. And finally, at Palo Alto, California, there were a group of scientists, loosely put, who were studying patterns of communication. And from this group evolved a particular approach to family therapy, and also probably one of the best known accounts of family pathology. Bell, as I mentioned, began treating families. He actually applied theories and models from group therapy, which were reasonably developed by that time. However, there really are some limits to this. While you can, in a sense, fire somebody from a group, you can't fire your parents. And Bell's ideas were not really well circulated. His adaptation of group therapy models to family work really didn't catch on. So one of the major areas that contributed to the development of family therapy was, as I said before, schizophrenia research. And if you're familiar with schizophrenia, patients will say very odd things, like, I feel like I'm just a robot, or everybody here is trying to kill me. And that sort of individual thought disorder was analogized to families. And studies showed, or descriptive studies showed, some unusual patterns of family communication. Um, and we'll talk more about those in a little bit. Some examples. Wynne and Singer were at the University of Rochester, and they described two patterns, again, characterizing families with somebody with schizophrenia. One was called pseudo-mutuality, which means false togetherness, basically. We are one big happy family. We never fight. We know what each other wants. We're completely unified. And the other concept was called the rubber fence. And the rubber fence is actually an invisible boundary around a family that prevents new input from coming in. Threatening ideas from the outside bounce off of the rubber fence because these outside influences could be very threatening to the family status quo. This gentleman we will see in action later in the course. Carl Whitaker was actually an obstetrician who changed to psychiatry. And in his early days, he worked with patients with schizophrenia. He also pioneered, in many respects, the use of having two therapists at the same time, co-therapy. And he was very experientially oriented. He thought that theory was actually sort of a cognitive straitjacket that prevented the therapist from being genuinely present with the family. He did, however, have some psychodynamic thoughts, sex and aggression being particularly important forces in family interaction. Murray Bowen, another guy we're going to spend a fair amount of time on. As I mentioned, he hospitalized whole families. He also had a multi-generational theory that was applied to family therapy. Bowen believed that something called undifferentiation, which is a lack of personal boundaries and being highly reactive emotionally to other family members, was a way of being that was passed on from generation to generation. And at one point, Bowen said it takes 10 generations to produce a schizophrenic. I think close to the time of his death, he hammered it down to 3. And so he really emphasized the importance of understanding families in the context of their multi-generational histories, and was a big proponent of using something we'll talk about called the structural genogram. And what he talked about was the concept of differentiation of self. What that means is someone who is well differentiated is someone who can not be highly reactive to other family members and maintain their own sense of identity, their own values as individuals when interacting with their families. The Palo Alto group was a very, very interesting group, and these folks are really considered to be, in many respects, the founders of contemporary family therapy. This was relatively soon after the Second World War, so cybernetics, the idea of information patterns, was a relatively new idea. And the gentleman in the picture, Gregory Bateson, who was an anthropologist, actually worked on some of these projects during the Second World War. They began a study of different types of communication and included a guy named Jay Haley, whose master's degree was in communication. Again, not a mental health professional. John Weakland, who was an engineer, I think he later got a master's in anthropology, and you can see of the four, only one, Don Jackson, was actually a formally trained mental health professional. Cybernetics is, in the sense we're talking about here, the study of self-correcting systems. And it's based upon the idea that systems have a stable point that there may be fluctuation around, but they return to that stable point, much like your thermostat in your house keeps a constant temperature. And so Bateson adapted some of these ideas to social systems. One of his famous accounts is of, I guess there were still some of these during his lifetime, rural villages in England where many people worked on a farm within these villages, and the farms were owned by the lord of the manor. And so there was a definite power relationship, but Bateson pointed out how once a year there were these games that occurred as part of a festival, and the lord of the manor would come down from his manor and play these games with the townspeople and invariably lose. And again, Bateson said that that was a way of correcting a hierarchy. He and Haley also studied rituals that occurred in other cultures, and again gave rise to this notion of content isn't as important as process. It's not what you say, but how you say it and who you say it to. So these folks, Bateson, Weakland, Haley, they were housed at the Palo Alto Veterans Administration Hospital and doing very unusual research on communications, such as the relationship between ventriloquists and the dummies that they worked with. They looked at animal communication, and particularly, and you'll see this with human beings to some extent, certainly with dogs and cats. You can distinguish between play fighting and real fighting. And Bateson in particular was interested in the nonverbal communication that was given off by animals to indicate this is not a real fight, this is a play fight. They also studied propaganda and why people were susceptible to it. Again, I know some of this sounds odd, but I'm putting it in here to stress these were not mainline mental health professionals. Bateson actually, during his time at the Veterans Administration Hospital, was down in the morgue, and he had these octopi in tanks down there, and he was attempting to communicate with them. Later, after he left the Palo Alto project, he got interested in communicating with dolphins. So this was the original double-blind group, and you see a woman with Bateson. That is Margaret Mead, who was a famous anthropologist of the time, who he was married to for a brief period. And that is Jay Haley and John Weakland together, and then the psychiatrist Don Jackson. Their major concept was what's called the double-blind theory of schizophrenia. And this was worked out by observing patients on the psychiatric unit at the Palo Alto VA. So what they would be looking at would be a situation where these were usually young adult men in the VA hospital who had schizophrenia, how they acted in family interactions. And one of the things they noticed was a double-bind style of communication. Uh, in the double-bind, there's these characteristics that are listed up there. But what Bateson and his friends would see would be, so the mother of one of these young adult patients would come on the ward and be standing there and saying, "Oh, aren't you glad to see me? Why don't you come over and give me a hug?" And so the patient would, and then the mother would pull away and say, "Oh, you mustn't be such a baby." So you can see that the first four characteristics are met there. Two or more persons, there's contradictory messages, there's a primary negative injunction, don't be a baby, I'm sorry, you're not being affectionate, and then the secondary one, don't be a baby. And if you, for those of you who had learning theory, remember the famous study that Pavlov did where he just developed dogs who had this, what was called experimental neurosis, was that he had these two discs, and the dog was reinforced for the disc that was, when they touched the disc, that was perfectly round. The other one was oval shaped, but gradually over time, the shape of the oval changed and became very, very close to that of the circle. And the dog began to have difficulty discriminating and became agitated. Number 5, the relationship is critical for survival. Again, remember, I'm taking somebody else's concept, but the families that were pseudo-mutual and had the rubber fence basically are communicating that you cannot live without us. Importantly, the contradiction cannot be directly commented on. So the young man cannot say, "Mom, you told me to give you a hug. I did. You pushed me away." Because that would mean, if you can comment on it, that this style of communication doesn't have as much power over you. And so what Bateson saw was that after one of these encounters, that the patient who had schizophrenia would become much more symptomatic, start hallucinating, verbalizing delusional content, those kinds of things. The other thing that they came up with was the concept of homeostasis. And it's the notion that families are units that resist change. And this was a very, very popular view in family therapy for a number of years. And Haley, in particular, who was also part of this group, argued that family systems sometimes needed, and those were the words that were used, a dysfunctional family member to keep the family together. So, for example, if mom and dad only unite when their child is acting out, that acting out is, quote, normal given its context. That child acting out actually brings unity to the family by being something that the parents can agree on when they can't agree on anything else. I've pretty much said most of these things, but if you are a student of history or sociology, family therapy really blasted off in the 60s and 70s, and this was a time in the United States and Western Europe in which authority was challenged. And again, within our field, the mental health field, the authorities were the behaviorists and the traditional psychodynamic therapists. And family therapy was seen as a rebellion against that. Also, there was much more attention being given to interpersonal context of problems. For example, President Lyndon Johnson's Great Society programs that gave us Head Start and anti-poverty programs highlighted how the social context influenced the individual. So by the early 70s, there were I would say the first 5 schools were well established, and within about 10 to 15 years, the last approach was established. So again, these are family therapies equivalents of cognitive behavioral therapy, humanistic therapy, um, psychodynamic therapy, etc. And each of them has their own explanation for why families have problems and what the therapist should do to address those. So the psychodynamic approach focused on family history, as I mentioned before. Um, Murray Bowen argued, and we're going to go into this in more detail in the course, so don't sweat it right now, that basically people were governed by 2 poles. One set of conflicting forces was to function emotionally versus intellectually. The other was to be independent versus succumbing to what others wanted you to do, the togetherness force of the family. James Framo, who we'll also talk about, took object relations theory, the notion that each of us carries around an unconscious model of what close relationships are like. And when we start dating and having close, intimate relationships, those objects are activated and they become the lens through which we see um, our partner. And it's often a distortion. Um, Jay Haley split apart from the what was called the double bind group and became really preoccupied with the concepts of power and control, and argued very strongly that the patient, the person with the symptoms, actually has the most power in many families. I mean, if you have schizophrenia and your verbalizations are characterized as irrational, you can get away with saying stuff like, I hate you, mom and dad, I wish you were dead. Of course, because you're ill, you don't, quote, really mean it. Um, he was also influenced by a very atypical psychiatrist who developed an interesting approach to hypnosis, a guy named Milton Erickson. And in their early work, Erickson argued that what you should do is accept and redirect the symptom. An example, Erickson was a consultant at a psychiatric hospital. There was a guy there with schizophrenia who was basically not very functional. He believed he was Jesus Christ. Erickson said to him, hey, if you're Jesus, you must be a pretty good carpenter. Make me some bookshelves. And of course, that redirected that symptom into the person being productive. This thermostat model, we'll come back to it, the idea that families can only tolerate a certain range of emotion or differences in opinion before they have to come back to a set point, was very, very popular. The problem with it was that these forces for stability were so strong that they would override therapy. Similarly, when you leave your door open, your thermostat will kick on the heat to keep the temperature at 72 degrees, even though cold air is pouring in. And so the thermostat model argued that families function the same way, but if you really adopted it, it was difficult to see how families could change. Now, newer views of cybernetics argue that systems are in constant flux. There's all movement all the time back and forth. There may be specified by a range. And they talked about negative feedback, which is a force for stability, and positive feedback, which is a force for change. Okay. And again, give you an example from engineering. The Mackinac Bridge is governed by the second cybernetics. In high winds, the bridge was built to move slightly. If it didn't move slightly in response to high winds, it would break. And one of the things that therapists did who adopted this model was to put a constancy, something that did not change within the family, oftentimes a new ritual. Okay? So, for example, Salvini Palazzoli in the Milan group, which were strategic therapists, they would give directives, and in one of their favorite ones was to the parents of a mentally ill young person, somebody with an eating disorder, with schizophrenia typically. They would say, here's what I want you to do, husband and wife, mom and dad. Every evening, after dinner, I want you to go out for 45 minutes at minimum. Leave the house and go do something together. When you come back and your son or daughter asks you where you were, you say, these things concern us only. What was interesting was it wasn't the identified patient that was most distressed. These families were often three-generation families, and it was the elder of the family that was most distressed by that intervention. Another key concept we'll talk about quite a bit in class, and your textbook does as well, is first and second order change. First order change is basically a change that occurs according to rules of the system. You know, in this class, if a first order change would be, if you said, Dr. Sierra, I'm not ready for this exam. You've given us a lot of material. Could we have an extra week before we take the exam? Sure. You're still taking the exam, remember. A second order change would be if after the first 3 or 4 weeks, I came into class and said, there won't be any exams, or I want you to make up your own exam and test yourself. That is a fundamental change in the rules of the system called second order change. To perform the task, connecting the dots using only 4 straight lines, you have to think in a second order way. You have to literally step out of the box. So strategic family therapists often focus on creating second order change so that the family shifts in its way of organizing itself. Yeah. Just to give you a small example, there was a child who wet the bed. The mother sort of begrudgingly changed and washed the sheets every morning. The father was sort of a distant, kind of disengaged figure, particularly with respect to the children. And so the therapist gave them the order, the directive, your wife shouldn't have to do this, you should do it. And apparently the problem stopped, according to strategic therapists, fairly quickly. Now, this is a more conventional model that you're familiar with. It's behaviorism. And basically, the behaviorists are responsible for several things within family therapy. One is the concept that couples stay together because there's mutual reinforcement within the relationship. And in problem relationships, there's an imbalance, meaning that one is usually giving a lot more than they're getting. And they use techniques such as communication skill training and caring days and contracts, which are basically set up so that you do something positive for your partner, usually every day. And again, couples that are highly distressed, oftentimes, I wouldn't dream of doing anything for her. She drives me crazy. And a therapist would then say, well, you're here for therapy. maybe we should not look at it as you're doing something for her, but doing something for the therapy process. And the idea is that more positive feelings will emerge in the relationship as a result of this reinforcement. Um, Structural therapists look at families as having specific roles and boundaries, and families have problems when those boundaries are crossed. So, a mother who is married to a guy that she fights with a lot because he drinks. One evening when he comes home drunk, turns to the 12-year-old daughter and says, "This is the 10th time he's done it in the past 2 months. You think I should divorce him?" That puts the child in a parent-like role and is going to be associated with problems. Three-generation families in which the grandmother of the child overrides the mother is an example of a breakdown in boundaries. Um, the experiential folks, Whitaker and Kempler's a Gestalt therapist, really see families as sets of individuals, and their role as a therapist is to help individuals develop their potential. Uniqueness is seen as a good thing. Conflict is seen as desirable if it can get resolved. And so these therapists oftentimes have pretty intense emotional exchanges in the therapy sessions. Oftentimes one member screaming at another. And Whitaker sees that as desirable because that's authentic in his perspective relating. Narrative and social constructivist therapists, these folks came from a somewhat different view. They're heavily oriented towards linguistics. And they argue that how you label a problem affects how you respond to it. So if somebody is a procrastinator, one of the first things that they would do is talk about procrastination as an external force, or even as a sort of person. And I would ask you, when was the last time procrastination got a hold of you? What was going on then? And I might ask you, has there been any time this week when you were doing something important and procrastination reared its head, but you stomped it down? What was going on then? And this approach to therapy does not emphasize the therapist as an expert. The therapist is a collaborator who helps the family design new stories. These folks also were some of the first to look at gender and ethnicity and inequality within society, and how, for example, unequal gender roles get reproduced within the family. In the 1980s, there was a big push for theory. I love this stuff, by the way. I wrote a couple of articles on it. If you read them today, I'm not sure they're remotely coherent. That book, The Aesthetics of Change, was sort of seen as the Bible of this approach. There was growing attention to ethnic differences in families and gender roles within families. Oftentimes, again, this was at a point where there was a lot of sensitivity to the inequalities between men and women in society. And again, it was argued oftentimes that this inequality was reproduced within the therapy session. For example, a therapist who spends a lot of time talking with a husband about his job, but when talking with the wife or mother, talks about how she's doing with the kids. As diversity took hold, a lot of these models were applied to same-sex couples. And finally, and I remember presenting at the American Association of Marriage and Family Therapy right about the time that this came out. And we did a panel at AMFT, this was probably 1985, 1986, something like that, called Why Families Are Not Like Swamps, Solar Systems, or Thermostats. And we wrote a couple articles based on it. And the idea was that family therapy had really overlooked some basic things, like people have central nervous systems that account for problems like ADHD, and there is a role for pharmacotherapy. The feminist challenge began with looking at domestic violence. Basically, the argument that domestic violence was a way of preserving homeostasis was criticized as, in many respects, excusing it. This is also, I think, quite interesting, and I've spent a lot of time doing research in this area. Those of us of white Northern European background tend to see independence as very healthy. And if you remember Diana Baumrind and the concept of an authoritative parent, a good outcome is that your child becomes independent. Well, that is a cultural bias. And other cultures, Hispanic, Asian, often don't argue for or try to develop independence. It's not seen as appropriate or desirable. And not everybody addresses conflict directly. Sometimes they address it through stories, sometimes they address it through humor. Sexual orientation. Again, most of these models were applied to gay and lesbian couples, but the thing that was also added was there's also likely to be an element, probably more so in the past than recently, of social homophobia. Are you out to your parents, that kind of thing, that may be contributing to some of the issues within the couple. So what happened is that marriage and family therapy originally were these outsiders. It got incorporated into mental health and then developed as an independent profession. Many states now license marriage and family therapists independently of licensed professional counselors or psychologists. As I said before, there's a large professional association with its own journal, American Association of Marriage and Family Therapy. So it began to be recognized as a profession in its own right. And began to join the mainstream of mental health. One sign was that third-party payers, insurance companies, would pay for family therapy for certain problems. There was traditional research, quantitative research done, and it was seen not so much as being in opposition to individual treatment. However, you're still left with some very basic issues. What is a family? We still struggle with this one. And definitions of what is family are oftentimes pretty broad and may include people who are not biologically related but are perhaps long-term friends of one or both parents. And what is health in a family? And particularly with in vivo fertilization and single parenthood, are families even necessary anymore?